about yourself, Puneet?
Yeah, I can start with my answer.
Sure.
Basically, I'm a passionate individual hailing from a small town in Pakistan, and I did my schooling, I did my med school all there. I always had a compassionate streak in me since childhood, and the way I went into medicine, it's a bit interesting that it was a small school trip that got me into medicine, and then just I just went into it with full guns blazing. I basically got exposed to many different specialties in my med school, but ultimately landed on internal medicine because it's the most wide, most broad, the most complex field, which will lead me to continuously learn. Then I did my intern year, which basically laid the foundation of my professional career. Then I also went for a job along with preparing my steps, which was like a bit hard. Then I just came to US and I was exposed to a different kind of medicine, the most more resourceful, different kind of diseases, which allowed my mind to expand and broaden my horizons further. Apart from academic half, basically I like to use my time for a little bit of workout routine, do some light aerobic exercises, and indulge in entertainment, be it video games, be it movies, or like drama serials. I'm always on top of them. And secondly, I would also like to socialize with my friends, with my school friends, university friends, and all the friends that I made through my strep journey, because I know those are the friends that will remain for life. Thank you.
If somebody wants to talk about, like, give your feedback to Unaib.
I would love that, please.
Yes, hello. Is Am I audible?
Yeah, just so you please can you introduce with your name?
Yes. Sorry, that's a misconception. I am not able to change my name. I am Shiasha Kandakunda. Uh, I'm also an applicant this season.
Anybody, please?
Yeah, I'm
Any
sorry, you can just go
comments?
ahead. I think I just muted you accidentally. Yeah, I'm so sorry. I was about to mute somebody else.
Yeah, no
Yeah,
worries,
please
no
go ahead.
worries.
Go ahead.
Yeah.
All right.
Okay, so I'm really dumb at tech, so I don't know how to change my name. So let me introduce myself. I am Shiasha Kandakunda. First of all, that was a really terrific answer. But
Thank you.
I just want to give you one feedback that I have learned
Mhm.
from other people is you were speaking at a like at a really fast pace, and I think a little bit of more structure, like a smooth flow would have been better. Like first, like are you and what are you doing currently, and then if you can just go back, like it just felt like a non-linear screenplay, but it was a good screenplay.
Mhm.
It's a good one. But this is what I have been told. I don't know if this is the elixir, but yeah, that's what I
No,
wanted to say.
you're right, because as I was speaking, I was also thinking to myself that I'm speaking a bit fast and I have to
Yeah,
structure it properly.
yeah, because I think
Thank you.
you had so much content to tell, you were just rushing.
Yes,
But
I
it was
was
a
just
great
going
answer,
through
though.
it.
It was a
Thank you,
great
thank
answer.
you.
So, Nave, like one more thing, it was a very good content, definitely, right? But the one thing that you have to focus on is that you have to avoid hand movements. Like yesterday, when I was seeing the video, I could see that I was doing a lot of head movements, right? I need to work on that as well. And you do a lot of hand movement. Even I do a lot of hand movements, but yeah, we should avoid that. We should just work on that because it makes you feel more confident when you do less movements. Yeah, otherwise, it's a very good answer. Yeah, so should we move to the next person who wants to talk about? Tell me about yourself. That's fine, Nirpit. I actually accidentally muted somebody else, so that's fine. So yeah, should we move to the next person who wants to talk? Like, if you want to speak on, tell me about yourself. Dr. VN Sai, like you want to speak something, or yeah, okay, I'll go with that answer then. right? So considering Dr. K is taking my is a program director is attending. So hi Dr. K, thank you so much for the opportunity for allowing me to get interviewed at your program. Myself Ayushman Gupta, an international medical graduate from Government Medical College Jammu. Currently, I'm working at Suvidha Maternity Hospital as a medical officer, and I do a part-time job. You're teaching students at ABC Academy, which these are the students preparing for USMLE, PLAB, and other exams for the post-graduation after their med school. I stay with my family in my hometown, comprising of my mom, my dad, and my sister, her two daughters, and I'm a dog dad to one 2 years old Labrador. After graduating, I have worked in multiple healthcare institutions, both across my city in urban and suburban areas. After that, I did my 4 months of United States clinical experience across 4 states this year. Talking about my voluntary work, I am a regular blood donor. I served as a state coordinator for Medical Student Association of India, which is one of the largest association by the medical students in India. And I conducted, participated, and organized various events under that during my third year of medical school. Then I attended many rural camps. I attended many rural camps as a member of National Medical Organization, an initiative by Doctors of India. Apart from that, I regularly participate in blood awareness campaigns and blood donation camps. Talking about my non-medical interests, firstly, I love to cook Indian food. I watch the YouTube videos and try to cook, whatever I search, I try to cook that in a healthier way for my family and friends. I like to go for swim 5 days a week, and I recently joined gym as well to keep myself active and lose some weight. Then I run an Instagram page by the name of Instagram where I connect with 1,800 fellow international medical graduates. I share snippets from my USMLE journey over there, and I answered their hundreds of questions every month. Also, I advocate for the mentorship sessions, and I've mentored 50 students so far. So yeah, that's me. Yeah, I would just like your feedback on that.
It was a really good answer. You packed a lot of content in there, and the flow was really nice too because you went through stages. Like first, who are you, where you come from, your med school, your USMLE journey, then your volunteer experiences, and a little bit about your hobbies. I think that was a good answer.
Thank you so much. So basically, I just saw Malkisad's video today and he told that your answer you should not be directly praising about your like whatever good you have done, right? But you have to indirectly mention those things that shows you're a leader or your teamwork, right? So that's why I tried to incorporate voluntary work, though it's not very necessary. But yeah, I was state coordinator for MSA at Jammu and Kashmir. So I thought that I should, mention that would show like my little bit of my team leader skills. And apart from that, just to show my that I am empathetic as well. So I mentioned about my blood donation as well. Like, and I actually do it. So yeah. So should we move, or like anybody else wants to speak, or like we should move to the next person?
Hi, I'd like to speak about this question. Tell me about yourself.
Sure, go ahead, go ahead.
So hi, I'm Hannah. I'm originally from India, but I've lived all over the Middle East. So I moved from Saudi Arabia to Dubai to Qatar. So moving around was a big part of my childhood. I come from a small family of four. It's just my parents and my twin brother and I. Growing up, my family placed a lot of importance on education, and that always came above everything else. So, from a young age, both my brother and I were interested in medicine. So, when we were in eighth grade, my parents sent us to India to study. So, it was a little difficult being apart from family, but it allowed us to form a genuine connection with our home country and also helped us get into good medical schools. And during medical school, I did a lot of volunteer work in rural areas, and seeing a lot of the patients there struggle with mental health issues is what. So I'm interested in psychiatry. So this is what got me interested in psychiatry. And this led me to do a couple of months of rotation in the US as well. And I really enjoyed the learning environment here. Then outside the hospital, I'm someone who likes to keep active. I play a little bit of basketball, and I even started this dance club for students during my medical school, for students who had the same interest. And that's something that I really enjoyed being a part of. And whenever I get a little bit of time, I love traveling. I've done a lot of traveling in India and parts of Europe and Asia as well. So I'm someone who loves experiencing new things, and I'm very eager to learn. And I'm really excited to be here and have this opportunity to interview with you. Yeah, that's it.
Yeah, that's very nice, Hannah. Like that's a very good answer. But yeah, only one thing is just try to compile it into 90 seconds, not more than that.
Okay.
Otherwise, you speak very well. Your accent is even very good, and your voice was even good. Like we could, yeah, it was a very good. It was very nice and it was easily audible. But yeah, just work on your content little
Okay, so it was a little
bit.
long.
Yeah, a little bit long. Like, yeah, if it's for 15 minutes, then why you want to give that much time to this question? Otherwise, covered a lot of things, and that's good, right? There's no specific format for tell me about yourself, right? But yeah, it's actually subjective. It's individualized. Like it depends upon the individual, right? But otherwise, it was very
Yeah.
concise. That's what I would say. Like anything, anybody else wants to add something? Go ahead.
Please, any feedback is appreciated.
The content was really good because it basically gave me an idea who is Hannah. I know like what your life journey was in the beginning and now what you have done till now, what you are doing. What are your, apart from your academic aspects, what do you like to do in your spare time?
Yeah, okay, thank you.
So, like Shubhangi, you just raise your hands. Please go ahead. Like if you want to answer the question.
Yeah, sure. I'll answer. Tell me about yourself. Thank you for taking time to meet me. My name is Dr. Shubhangi, but you can call me Angie. I was born and raised in eastern part of India, specifically in Bihar. I completed my medical school at Nalanda Medical College and Hospital. My journey in medicine has been marked by both academic achievements and significant clinical experiences. I completed my clinical rotation in United States to get a glimpse of US healthcare system. My international experience as a junior resident in India provided me with strong foundation in patient care across various departments, and I have learned the importance of compassion and delivering the highest standard of care. I have been actively involved in learning about research, contributing to various projects. Aside from medicine, I am a passionate learner and a seeker of new experiences. Currently, I'm excited about taking a professional scuba diving course and exploring artificial intelligence potential in healthcare. I'm eager to further my career in internal medicine with a strong commitment to academics, research, and a high quality patient care. I look forward to our discussion today, where I hope to share more about my experiences and how they align with the requirements of your program. Thank you for considering my candidacy. So that's it.
Yeah. Somebody wants to add something to this? Like you want to give your feedback?
You can add some hobbies, your personal touch if you would like to add. Other than that, you talked about your professional aspect, why internal medicines, why this career, and your credential you explained pretty well, and it was well thought. Yeah, that's my comment.
Okay, thank you.
Shubhangi, the answer is very, very good. But it feels like you're well practiced this answer, right? So, like, try to be more spontaneous. Otherwise, the content is very good. Your voice is
Yeah, yeah.
just it was
Thank you.
like even the answer I gave. I feel that it looks like it's more practice. So, like the people say, you should try to be more spontaneous, right? Otherwise, it was a very, very good answer. Very, very good. Yeah.
Yeah, thank you.
We move to the next person. Like, tell me about yourself.
Yes, can I go?
Sure, go ahead.
Yeah. Okay, so I didn't practice much, so hopefully I'll tank. Anyways, yeah.
Be
So,
spontaneous, right?
yeah. So, I would really like to take an opportunity to thank you for inviting me for an interview. I am Siyasha Kandlakunta. I am from Hyderabad, India, which is in the southern part of India. I am currently working as a research fellow in Mayo Clinic, Rochester, Minnesota, in the Department of Cardiology. So, a little bit about my background. I moved around and grew up in three different countries thanks to my father's career as a research scientist. So, I was exposed to diverse cultures and different languages since I was a child, which made it easy to connect with people, and it became a part of my personality since then. And I grew up in a family of doctors, so naturally I was inclined to be one. And fortunately, I had the best internal medicine rotations during my medical school, which shaped my goal towards it. And when I came to US and was exposed to the evidence-based healthcare and the emphasis on it, I developed interest in it and did a couple of rotations in New York, Texas, and Rochester to gain a huge insight into this medical care. And apart from this, I also volunteer at a hospitality home near my institute, which I'm hugely passionate about. And in my free time, I love watching movies, and I'm a huge consumer of stand-up comedy. And I love traveling to different places, and especially exploring their cuisines. And I am the guy who would always recommend you try this cuisine, try this food, etc. And I'm really excited to be here and be doing this interview with you today. Thank you. Any feedback will be really appreciated. Thank you.
That was a good answer. You haven't practiced this, right?
No, unfortunately, no.
Yeah.
So, yeah.
That was like sounding a bit more spontaneous because, and that's a good thing, basically, because we have to look spontaneous. We don't have to look rehearsed at all. Otherwise, the content was good. Just your hobbies were also fine, like traveling and stuff. Just a little bit more about that. I think it was adequate enough. I think the answer was
Okay.
good.
Sure. Thank you.
A very good answer. Like, yeah, it was a very good answer. Yes. And it was very spontaneous as well. So it was a good answer.
Thank you.
გამარჯობათ ქალბატონო თამარ თუ დროს ხوار გირეკავთ მარიამი ой ალბათ აქ არის თქვენ გრძელიშვილი ბრძანდებით ხო გრძელიშვილი
Yeah. So should we move to the next person? Ishan, do you want to speak?
Yeah, Ushman.
Yeah, go ahead.
Yeah, you know what? I didn't write my answer at all. I forgot to do that today.
Then just go ahead, like whatever. If you want to speak, then just go ahead. It's fine. Even nobody's well prepared, right? We have a lot of things going on, and it's just like a practice session.
Oh no, I don't even have my points ready. Okay, but I can try. I mean,
okay, go ahead.
Sure. Okay. Oh, so how do you start? Can you give me a so hello, doctors. It's really nice to be here. I'm excited to get this opportunity to be at this interview here today. My name is Ishan. I come from Pune, which is a metropolitan city in India. So I'm a second generation doctor in the family, and I started my journey in medicine when I had Guillain-Barré syndrome, and instead of getting like scared of the diagnosis, I was like intrigued by it, and then it led me to start medical school. During medical school, I had a lot of great mentors, and in internal medicine especially, and from certain patient experiences, I got intrigued towards that branch, and so I started. Yeah, you know what? I this is the answer I have come up with. You know, after that, I can say that yeah, I also have a rural and urban experience because my medical school in my medical school I had rural experience as well as urban experience during my internship, and it helped me to what? No, okay, I don't have an answer. I've just done this much. I can't think it through.
That's fine. That's fine. Yeah, yeah. Even if it was good content, you just have to just frame it well. Otherwise, it's good content, right?
No, I even forgot the content. I have to write it down. Okay,
So that's a tough
sorry.
task. I would.
Anything else I should include in this? Oh, other than my hobbies, I'll end it with the hobbies. Sorry. Yeah, I like to sketch on shoes and yeah, just
Yeah, just
nothing
frame
else.
like
Don't have.
just keep the points in your mind. Like, what are your hobbies? Like, what do you want to talk about? Right? Like three, four
Mhm.
hobbies, and then you just mention or keep the points. Like, don't note down the exact answer. Just note down the points that you want. You want to talk about your medical school, your background, that you're a second generation doctor, so that it comes out spontaneously instead of writing the whole answer and then working on it. Like it will look like more practiced. Like that's what I
Mhm.
feel my answer is. I feel that it feels like I've practiced a lot about my answer. So I even need to be more
Mhm.
spontaneous rather than just going by a draft. I should just work on points and speak spontaneously.
Yeah, I'll get my points in order first, and then I'll make up the answer.
Yeah.
Yeah. Sorry
And
for that.
oh, that's a
Sorry
good.
for that answer.
So yeah, Harshita, you want to speak something?
Yeah, Ishan, you can add probably USCs and all that if you want.
Oh, yeah, right. That's a good idea. Yeah, we'll do that. Mhm. Thank you. Thank you.
Yeah, no
I'm
problem.
writing it down right now.
Yeah. One more thing, if you have any voluntary experiences, because you mentioned about some medical condition, so you can like probably weave around like how you were, you understand the suffering of someone, right? So how that led
Right.
you to doing some voluntary work. I think it'll add one point,
Yeah, that's a good
I
idea.
mean,
Yeah, I
obviously, we
have
don't know what
certain volunteer
completely what.
experiences. Yeah, yeah.
Yeah,
Thank you. Yeah, yeah, I do that. Thank
yeah,
you.
no worries.
Okay. Anyone else? I mean, it wasn't a very good answer, but still, anything I should add? Okay.
Just go ahead, Ishan. Just when you draft the question, just sit. It'll hardly take 5 minutes. Just sit and just mention what points you want to talk about during the, tell me about yourself. Like it is an individual thing. Like many people, right now told about their interest in internal medicine. Like like,
Yeah.
it depends. Everybody have their own draft. It's not something that I'm going to copy that person or that person is going to copy me. Everyone has their
Correct.
unique,
Yeah.
right? Some people have done a lot of good work, right? So
Mm-hmm.
it's up to you. Like you just draft the answer in your, we just draft the points, and you just try to practice it, like how you're going to speak it, so that you don't fumble while speaking this answer, right? That's the main point, because that is the first
Sure,
thing you
sure,
have to do,
Ayushman. Mm-hmm.
to give an impression to the attending. Otherwise, yeah, it was a good content, but just concise it
Yeah.
in the right way and phrase it well.
Mm-hmm. Thank you. Thank you. You caught me off guard, Ayushman. I wasn't going to say anything, but okay.
So yeah,
Thank
because
you.
I know you, that's why I took your name, right? So yeah, talk about like this question, then we can move to the next question.
Hello.
Yeah, hi Sarthak, go ahead.
Hi. I have not prepared anything, but I think I should speak so I can speak later. So can I start?
Sorry, you want to speak later on?
No, no. I want to speak right now.
Sure, go ahead. Please go ahead. Yeah.
So thank you for giving this wonderful opportunity for today's interview. My name is Sarthak Dhruv, and I come from west side of India, Gujarat. And I did my medical school from Siusha Medical College, India. Like I come from a doctor family. Like my father is plastic surgeon and my mother is gynecologist. So from them, I from childhood I saw them as my idol, and I always wanted to be a great doctor like them. And my brother is also a hospitalist in Maryland, and so after he came there and I did my US clinical rotations there around 4 months, I my interest in doing internal medicine in US emerged greatly, and so I want to do. I want to continue my internal medicine in US. And currently, I work as a patient coordinator in a Smile Train program, which is a non-charitable trust, non-profitable charity trust, which helps patient with cleft lip patients operate freely. And I also do some voluntary work, like I'm also a member in Robin Hood Army, which provide free foods to uh, like poor people who are needy. And apart from this, I'm studying, preparing for step 3 right now. And I also like my hobbies are chess, to play chess, to do swimming, also do sometimes meditation, and I like to play badminton. So, like, that's me. It's me.
You have a lot of content to say, just phrase it well, otherwise you can have a perfect answer. You are, like, I know about Smile Train as well, like the hospital I used to work in. Over there we used to have a cleft lip and palate patients. Sorry, they
Yes.
just yeah, they just deal, so that's a very good thing. So you just phrase it well, otherwise you have a lot of content to speak
Yeah.
up, and you speak very well. Yeah. Anybody else wants to add something, and then we'll move on to Divya. She wants to speak next.
Any feedback,
So,
guys?
I also agree with Ayushman. Your content was like very good. Just phrase it accordingly, like the what are you doing? What was your past? What was your uh, basically the reason you went into medicine? Which are your parents? Because they were your idols. And then a little bit about a USC, and then cap it off with hobbies. That's it. Perfect answer.
Okay. Okay. Thank you.
Yeah. Should we move on to Divya? Divya, please go ahead.
Yeah, I'm Aishman. Thank you so much. Uh, Good morning, everyone. It's a pleasure to meet all of you all, and thank you for giving me this opportunity. My name is Divya Madhuri. I am an international medical graduate, born and raised in India. I received my medical education in Medicity Institute of Medical Sciences. That's where my interest for pathology grew, and that led me to take up this career as pathologist. And I have finished my residency in one of the India's topmost medical college, Usmania Medical College. During my residency time for 3 years in Usmania, I have learned about how this teamwork going to work. I have learned adapting to new situations and working with colleagues and all. Then, after finishing my residency, I worked as a consultant pathology in one of the private labs in Hyderabad for a couple of years, and that was my first hand experience in the market. And now that I am ECFMG certified, I am looking forward to strengthen my skills in pathology in US. On the personal note, I am the only doctor in my family. I am married, and I have a 4-year-old kid. And my hobbies are cooking. I have special interests for cooking, and I love to cook Indian food. So overall, I think I am a well-rounded personality, and I have passion and dedication towards the field. Given a chance, I think I believe that I can meet the expectations to the best of my ability. Thank you for having me. I don't know. This is the first time I'm speaking somewhere. I don't know how did it sound.
Yeah, anything, anybody wants to give the feedback to Divya?
Yeah,
It
if it was
sounded,
the first time,
please.
yeah, go ahead. Like, yeah. Okay, should I go ahead? Yeah. If it was the first time, it was a really terrific answer. I don't know if I probably missed it. Like, did you like come to the US and did you do any
Yes,
pathology
yes.
rotations here?
I,
Oh,
I
sorry.
didn't do anything in US actually. It was all virtual because of the kid and all. It was not
Okay.
possible for me to come to US.
Yeah, you can mention that. You can mention that. Like apart from that, it was a really good answer. I really like
Mhm.
this answer. It was
Do you
really good.
think it's wise to talk about telerotations or something, or just
Yeah.
leave that?
Yes, 100%. It is an experience, right?
Yes, yes.
You have gained a unique experience, and it will give a unique perspective. It can speak about your adaptability to your situation, and I felt you can also expand a little bit more on your hobbies. And apart from
Okay.
that, really great answer.
Thank you. Thank you so much.
Yes, basically that's what I was going to say. The answer was great. Just expand a bit on your hobbies. Like you like cooking, say a bit about cuisines, different cuisines you'd like to try. You watch YouTube videos to better your self skills, like that.
Mhm. All right, all right. Thank you so much, Shinib. Thank you, Aishma.
Great answer, Divya. So yeah, just practice well and you will just ace your interview. So yeah, should we move on to the next question or somebody else wants to talk about the question?
I want to answer the
Sure, go
question
ahead.
of the
Dr.
travelers.
Roshan, go ahead.
Okay. Hi, my name is Rejwana. I was born in Dhaka, Bangladesh, but was raised in different places as my dad moved a lot due to his work. That made me more passionate about traveling. I already traveled different places in the North America, Europe, and Asia. That made me a more adaptable person. I know how to adapt in different situations pretty well. I graduated from the Solimula Medical College. After that, I got a 2 years of clinical training in internal medicines. To get more advanced training in medicines, as well as to know more about research, I moved to the USA. I got my master's degree from Oregon State University in the microbiology department. My research was focusing on finding out the cause of antibiotic tolerance. I have a 2 year plus US clinical experience. Last month, I finished one rotations from progressive care unit as well as finished my step 3. I have been involved in different volunteering activities, both in the USA and Bangladesh, to serve the underprivileged people. Apart from practicing medicine, I love traveling, as well as I love to shop from the thrift store. I love hiking, kayaking. I'm happily married with my high school sweetheart for 10 years, and he's my biggest support to continue my journey in the US. So, in short, this is my story.
That's a very, I think that's a very good answer, Dr. Rajani. Yeah, very well. You it feels that you practiced and you just drafted a very good question, a very good answer. It's a very good answer, to be honest. For me, like anybody else wants to add something, or we should just shift to Harsh.
Uh, just a little bit, like you said, you like to travel. Just a little bit, expand on it a bit. Like tell which places you hope to travel in the future. That's just it. Otherwise, the answer was good.
Okay, okay. And should I increase more about my clinical training or clinical experience in the USA, or just what I said is enough?
It's enough. Like I think you
I
should
I
give
think it's enough too. Yes.
you should just give them
Oh,
a chance. They might ask you about it specifically, right? When they ask you specifically about that, you should have something left to talk about, right?
right. Okay.
Otherwise, it's a good question, a good answer. Right? So, Harsh, yeah, please go ahead.
Hey, am I audible?
Yeah, yeah.
Hello.
Go ahead.
Okay.
क्या हो गया मैंने ये थोड़ी ना कहा मैं
Okay. So I'm really grateful for this opportunity to interview at your program, and I hope my qualities that I put in today fit with your program. I am Harsh, and I grew up in a city of Surat in Gujarat, and I did my schooling from an army school. Belonging to a family of healthcare, I was exposed to medicine early in my life. And volunteering throughout the healthcare camps organized by my father, serving the underserved, developed a deeper connection with the medicine. Um, with this motivation, I secured an All India rank of 38, which gave me an opportunity to pursue my medical school from one of the top ranking institutes in the country, which is Maulana Azad Medical College, and which helped me shape my career goals further and develop a skill set that built confidence in me as a doctor. Further, I rotated in US for 3 months in Augusta University and Florida Healthcare, and which further broadened the concept of US healthcare and affirmed my goals to pursue medicine in US. Apart from medicine and academics, I am a versatile athlete and a dancer with weight training and basketball as my primaries, and I have love for all the sports. I am also part of my medical school volleyball team and football team. And further, I am fond of treks and mountain hikes. If that's sufficient, or should I add more? I mean, I've written more.
That's good. Like that's good enough. Like this, you just have to work. Like make sure it's about 16 the 90 seconds or even maximum 2 minutes, not more than that. Otherwise, it's a good point that you highlighted your medical college because Malana Azad is one of the premier institutions of our country, and many program directors they know about it and they give value to that, right?
Yeah.
So yeah, that's a very good thing that you mentioned about your this. If
Okay,
you
should I
have,
mention more about the research thing or anything?
just go ahead, just whatever you have, you can mind, you can just finish your answer.
I mean, like, I would, like, further it is, like, I would want to give a huge credit to the sports, which helped me build the necessary endurance and become an outlet while juggling through academic responsibilities during my med school, further helping me socialize with fellows and develop personal relations. The consistency and regular practice sessions shaped my skills as a team member and even take on role as organizers during resource constraints. This was much like my internship with a heavy workload and long working hours, striving through it, supporting my colleagues as a team. That's it.
I would say the last part you can say if you said about strength. If you ask about your strength, maybe you can say about your team membership and being the leader and teamwork. Maybe.
Okay, so I should not mention it here,
So
right?
I don't. So it's preferable not to burn every answer that you have during the tell me about yourself. So actually, so the thing is, you guide the interviewer, meaning that when you say, for example, you talked about basketball, weightlifting, the interviewer may ask you, so where do you weightlift? How did you come to do weightlifting? Why are you practicing? Are you practicing alone? You know, sometimes they ask questions from the things that you tell them.
All right.
Yeah, so just prepare yourself for any part that you say that you have to be answer the questions related to it. Yeah.
Okay. Apart from it, anything else you want to say?
No, it's very good.
Just a little bit. Your answer was sounding a bit like you're reading, and it sounds a bit rehearsed. Like because when you're speaking
Yeah.
spontaneously, whatever the word it comes to you for that particular situation, you just speak it. Your answers were looking like you have written it properly and you've just memorized it and you're just reading it off. So just work it on a bit. Like it must look a bit spontaneous. Otherwise, it was content was good.
Okay. Thank you. Thank you so
Also,
much.
you really need to work on like what points you need to highlight, right? You're gonna talk about everything. You have a lot of good stuff. Just highlight the points you have and make sure like you can't talk about everything in your introduction, right? You have to keep something for the end also. Like you have to keep something for the counter questions also. If they ask something like about the sports, then you need to have content for that as well, right? And
Okay.
you don't want that interview. You should just end with your introduction only. Otherwise, you have a lot of content, right? Just concise it in the right way. Otherwise, it's a good answer. You speak really well, and just practice a little bit more. That's it. And try to be more spontaneous. Just highlight those points in your mind and just speak about them spontaneously. Otherwise, you speak very well.
Thank you. Thank you so much.
Next question. Like I think we are 44 minutes into this, and we just have 45 minutes left. Should we move on to next question? Why you wanted to be a doctor? I think we should because should we move or anybody else wants to speak?
Yeah, could I speak?
Yeah, sure, go ahead.
So,
And
I want
just
to
be a
thank
little
you.
bit more loud, Dr. Fauzi, please.
You hear me?
Yeah, we just be a little bit more loud. Yeah,
Okay.
please. Yeah.
Yeah. So I want first to thank you for giving me this opportunity to interview with you today. I'm Amr Fauzi. I'm an Egyptian Canadian. I grew up in Toronto, Canada until I finished my high school, and then I went back to Cairo, Egypt for my medical school. Growing up in a physician family, my mother is a pediatrician, my father is a cardiac surgeon. I got impressed by their passion towards their patients and their community involvement to get to enter medicine. After I finished my medical school and I finished my house officer, I started my internal medicine residency. And then I wanted to practice medicine in the US. So I came here to the US and started as a physician assistant in New York Medical and Vascular Care Practice. I've been more than 6 months there. Besides my studies, I was an event coordinator in one of the community clubs in my university, and I love swimming. I was also my swimming team leader. I also love traveling. I will travel to 11 countries. Okay. What do you think?
Yeah, just it was a good question. Just end with something like just a closing statement like that's me, or that is what I want to say about me, or something like that. Don't just end it abruptly.
So
Otherwise,
yeah,
it's a good. Yeah, and as Dr. Unaid said many times, when you talk about travel, just come up with a little bit example. Also, I traveled to these many places, right? So it looks. Otherwise, it's a good answer. You speak really well. Just don't end it abruptly. Just come up with a closing statement. Yeah, like that's me or something that you feel is right.
Okay.
Right. Otherwise, it's you speak really well.
Okay. Anything else?
I think it was a good answer. The same thing that I was going to say. If you like whatever, if you're mentioning cooking, tell a little bit about which dishes you want to try. If you're traveling enthusiast, tell a little bit which countries you want to visit. That's it. Otherwise, it was good.
Okay. Thank you.
So, like, should we move to the next question? Why you wanted to be a doctor? Because I think we have given 47 minutes to this question, and like a lot of people answered this. Anybody else wants to speak? Hamza, you want to speak? Go ahead.
No, I think I'm fine.
Okay, so should we go ahead or with the next
Hello,
question?
Aishman, I want to speak.
Yeah,
Just
go ahead, Jaya. Yeah. Sorry, I muted you. I'm sorry.
Okay, it's okay. Okay, I'm trying. I know I may not be prepared well. So thank you for letting me the opportunity to tell me about myself. I am Jayaprada, a graduate from Dow Medical College, Karachi, Pakistan. I was born and raised in small village of Pakistan, that is in rural area. Um, ki- uh, Getting into medicine is what was not easy for me, to breaking stereotypes of society norms and cultural values. So thank you to my father who had stood behind me and supported me, and making my aspiration come true. Throughout childhood, I've seen my father, who himself is a doctor, seeing him or his care towards his patients, dedication towards his career, make a strong impact on me, and that's how I led to choose medicine in career path. Throughout my life, I moved to many places due to my studies, and that's how I was easily adaptable and adjustable to different environment and different people. That's, I think, good quality for me, maybe. I After graduation from Dow Medical College, I have done 1 year of internship in Karachi. Then I moved to my place, my village, where I worked with my father at his clinic. So I have gaining experience in rural and also urban areas. That's how make healthcare system diverse. I'm diversity. After that, I've for like 1.5 year, I've worked as a medical officer in Hyderabad, and currently I'm preparing as a currently I am in US, exploring US healthcare system, and doing a observership in hospital, and also preparing for step 3. Apart from this, I am a very family-oriented person. In my free time, I usually spend time with my family. Also, whenever I get time, I used to move to my village, have some time with a family, and also the nature. I really like to experience sunsets on sitting on the Moundy sand. This is what my area is, a little bit sandy. And apart from, I have a hobby of in art, like a mehndi, practicing mehndi on hands and papers. This is what I used to do in my school and college days. So that's me. I hope you like my introduction. Okay, so please feedback.
I would say you said I am adaptable, so that's a good quality of mine. And finally, you said this is my. I hope you like it. So definitely, the person who is taking your interview would like that or would understand. So you are
Yeah,
to
this
have
is
those
a little bit
qualities.
immature. I think this is a little bit immature line, but it comes just to my mouth. I didn't want to
Yeah,
say
so
it.
if you want to like skip that part, otherwise
Yeah.
I think it would be I'm more
Yeah, I know.
professional.
Yeah, a little bit shaky. Something, some lines I just don't want to say it, but it just come out of through anxiety and maybe nervousness. So apart from
No,
that, like what?
your content were good and you looks confident. It was not looking anything like you rehearsed. It's spontaneous. It was
Yeah,
spontaneous.
it is
Just you have
spontaneous.
to skip those. Yeah, you just skip those lines. Otherwise, it sounds good.
Okay,
And
thank you,
one more
Rajan.
thing, Jaya, just yeah, Jaya, one more thing is that yeah, being adaptable or something you can add to your strengths. You should
Yeah.
leave something for the other questions as well, right? They might ask
Okay.
you a lot of things, so you can just like make it a little bit more smaller, and you can just add
Hmm.
the good points you have, some of the good points, and for the other questions also,
Okay.
right? If they ask you the next question, why you wanted to be a doctor, right? So you should have some different content instead of repeating the same things,
Okay.
right?
So
Not in your case, like in general case. Like if I talk in my introduction about why I wanted to be a doctor, and next question they come up with why you wanted to be a doctor, right? Then
hmm.
I should have something for that as well. So it's
So I
good.
should keep a little bit part for that, not mention
Like
all the
maybe
things in
being
it. Tell
adaptable
me about
can be
yourself.
your strength, right? It can.
Yeah, yeah, that's a very good point. I can. I think it's been a very long. Tell me about yourself. I think I've said.
It was little
Yeah.
long, but you speak really well and it's very clear.
Okay, thank you so much. And what about the content? I should mention any other thing or this content, like other thing I
That's
should
too
want. Yeah,
much content to
just stick,
mention. You just stick
just
to it
stick.
and concise it. Concise it.
Okay, okay,
It's a very good content you have, but leave something for the other questions also.
okay, okay. Appreciate. I thank you so much for your feedback, Ayushman.
Also, I would like to add one thing. First of all, great content. I think if you can just write this answer down and if you can put a timer on it and make sure you don't cross the 1 minute or 1.5 minute mark, I think you'll be really great. And
Okay.
one interesting thing about your hobbies, you mentioned about mehendi. That might not be easily understandable to the PD. So
Yeah.
what you can really tell about it in a very using colorful adjectives, right? So that will be an interesting part that will maybe they'll remember you for that. Or if the person who's interviewing you knows about it, that will be a just an interesting insight about you. Otherwise, great content. If you can just keep it concise and you speak very well.
One thing I want to also mention about Mehndi. Actually,
Sorry, you can say henna instead of mehendi.
Okay.
Henna is the
Actually,
English word.
Actually, I want to explain it a little bit, but I thought it is like not required or it may be exaggerated for my hobby. That's why I just mentioned henna. It was just a word that I just want
No,
to.
no, it's very not a lot of women do now. Please add it.
Okay.
But say
Okay.
henna
Yeah, it's a
instead of
it's a
mehendi.
unique thing for you. Yeah, you should add it.
Okay. Thank you so much.
Unique hobby you have, instead of just talking about sunsets or something, you can just mention your these hobby. You can highlight your these hobbies, right?
Okay.
They might ask about your henna or mehendi,
Maybe.
right? So like
Okay.
you have to choose like what do you want to highlight, because you cannot talk about everything in your tell me about yourself.
Yeah, I can at least I can talk about this in my next question because I can. This is a genuine thing I
This is
can
a
do,
very
so
good
I can
hobby
talk
you have.
about.
That's an art, right? At the end of the day, somebody applying hindi or henna in your hand, somebody's hands. That's an art, right? Somebody likes
Okay.
painting. So it's a hobby and it's a good thing. You should definitely
Okay.
mention on that. But you just have to choose your hobby wisely, because you cannot talk about everything. Because even I like
Okay.
10 things, but I cannot mention that in my tell me about yourself, right?
Yeah.
Okay,
Yeah.
just
Yeah.
choose. Yeah.
Okay, so I just a little bit explain on my hobby thing and henna.
Yeah, so yeah, now we'll move on to Anusha, and that's the last question, and we'll shift on the next question because we don't want.
Ayushman, a very good point for Jaya. Can I add one line?
Yeah, go ahead, just quickly.
Yeah, please.
So yeah. So this Mehndi, you can there you can elaborate a little bit this your hobby in your advantage. Okay, a little bit one line of introduction. Like Mehndi is a like popular form of body art in South Asia, and it involves we do it in many like it's a traditional in many cultures, and also not only how to say it's a we can describe that it's the art of henna painting. Mostly people do on hands, and also it's a part of marriage traditions in many cultures, not only Hindus or in India. It's also in Sikhism and Islam, and they call it with different names like henna, little bit, and then you can say it. We connect to myself. I feel involved in it. It de-stresses me, or it's like I totally involved into it. It makes me feel good. You can add a little bit of things into it.
Or you
Actually,
could
first,
summarize it and just say like it's a form of body art. That's sacred to Southeast Asian culture.
yeah, South Asia.
Yeah,
It is.
it's a yeah. That's what Indu mentioned. It's a body art that's sacred to Southeast Asian culture, right?
Okay.
So it's a good point. So yeah, we'll just move to Anusha now, and then we'll just shift to the next question.
Yeah. Hi, this is my first time talking about this question, so bear with me, please.
Go ahead.
Okay. I'm Anusha. I hail from a small village in southern part of India. Growing up, I witnessed difficulty among the people around me facing growing up, I witnessed the people around me facing difficulty in accessing healthcare, which fueled my desire to become a doctor. Uh, I'm the first doctor in my family, and I think in my entire village, which gives me a sense of proud and responsibility. I graduated from Rajiv Gandhi University, which is one of the well-renowned universities in India. After which, I had the privilege of completing my residence in my chosen field, which enriched me personally and professionally. Uh, my journey to the US residency started a year ago, where I had the opportunity to gain experiences in US healthcare in different states for a period of a year. Uh, and my hobbies are I like to play throw ball. I think this taught me the value of coordination and teamwork. Apart from this, I like to sketch and I like to go on hiking. Uh, uh, I'm here excited to know more about your program and to share my experiences. That's it. Hello?
Yeah, it's good. Like we were thinking.
Okay. I actually did my residency in dermatology, so that's the reason I didn't mention about it. So I just told that I did my residency in my chosen field. I don't know how to uh, tell that.
Anyways, Anusha, they're going to ask you why you have
Yeah.
residency. So it doesn't matter. Like you can just talk because you have mentioned that in your CV. They're going to ask you. Next question will be that only.
Yeah.
You have to be prepared for your answer. That why I am shifting from dermatology to internal medicine.
Yeah, but I heard like few of them saying if I mention that and might tell me about yourself, they'll be irritated or they don't want to go beyond that. So that's the reason I thought I won't mention that. So I don't know if anyone can give some.
That's your call, but I don't think they are they are very open-minded because people do a home country residency for sure, right? Many people do
Yeah.
that. Many people who go from dermatology to IM. I think there's somebody by the name of Prachi Patel on Instagram. She has done it in ophthalmology and now she's doing it in IM, right? So many people do that, but you just need to have an answer why you're shifting your field from dermatology to internal medicine. That's the very important thing because if you're done, it's better. It's okay if you don't mention about dermatology because next question they can ask what was that, what was the specialty you did your home country residency in, and then they'll ask like why you're shifting from this to this because you're already done a residency in that. Now why internal medicine? So you just have to be prepared with that. Otherwise, it's a good introduction. Yeah.
Apart from that, rest of it, it's fine for this.
It's fine, and I think you should mention it because they already know. You mentioned it in your CV somehow. It would just by mentioning it, it would come off as that you're a bit more experienced than some fresh grads, right? That one line will tell them that you didn't waste your time. You did something extra, like residency or something, and they will ask you about it. You better have an answer for it, like dermatology residency, even if you don't mention it. Even I'm just saying it will highlight that you used your time. That's it.
Okay. Yeah.
So, Anusha, what is your reason for shifting from Dharma to IM?
I wasn't satisfied professionally actually because I felt my field was narrowed. I even while treating my patients, I had difficulty in managing if they had complications on steroids. Like we had to send them to I because usually people are not affordable, so we give steroids for chronic systemic conditions or autoimmune.
Yeah, I'm so sorry, Indu, to interrupt you. Like, we can just move to the next question because we are just left with 30 minutes, right?
Yeah.
So I'm so sorry to interrupt you.
All right.
Cover a maximum question.
You are muted, Ayushman.
Mute.
Okay, he's going on a monologue.
Yeah, can't hear you.
I'm sorry. Yeah. So yeah, what I'm saying is that we have to cover maximum number of questions. We have the 3 questions. So now Saurav and Jatin, I'm sorry. You can just talk about, tell me yourself about, once we finish, this meeting will go on, right? It's a recurring meeting, so we can just prolong it. But right now we'll shift to the next question, and you can start with why you wanted to be a doctor. If you have anything in your mind, you have drafted that, that's fine. Or anybody else wants to start with the question why you wanted to be a doctor? Uneb?
That is an interesting question. It takes me back to a little school trip that I took when I was in high school, and incidentally, I went into the same university that I did my med school from, and basically, I was just intrigued by. I still remember I went into the dissection lab and was just like enraptured by all the intricate human anatomy, how passionately the professor was speaking about it. And I remember at that was the crucial decision time that we have to choose pre-med or pre-engineering at that time. So it was just a slam dunk for me because I'm a first generation physician in my family. I had no I would say role models before that. So it was a very natural way to like find myself into the medicine, and I don't regret it. I basically have enjoyed it since till now. All the experiences I've gained, they have always helped me consistently throughout my life. Thank you.
Yeah, that's a good answer. Anybody wants to add something to this, like they want to say, or should we move to the next person?
Feedback, guys, please.
Or you can just type in the
I also tried to tone down my hand movements.
Yeah,
It
that's
was fantastic. No comment on that.
so yeah. Should we
I
move?
was just thinking that maybe he can make it a little bit colorful, like when he was seeing through the windows and there were the med students, and when he looked towards them, then he thought that maybe a little bit color about it, because it seemed a little colorless to me. It was a very good start,
Yes.
but maybe you can make it a little bit colorful, like you were passing through the lobby, and then you saw that there was this bunch of students going through the hallway, and you could see they were all happy. How Will Smith says in Pursuit of Happiness, like when he crosses that road
Yes.
and everybody was happy, like that. Maybe you can do that.
Yes. That is a very good feedback. Thank you, Hina.
And also
Yes, you're
this thing,
welcome.
like the white coat and the black shoes the doctors wears,
Yes.
it's like a old school answer. So if you, I mean, it's your choice. I would not say that because it's something is not unique. Just seeing someone with the white coat, so I would not
Maybe you
add
can
in.
say that everybody was happy, and then you could see the happiness on their faces, the joy, the colors, the how vibrant they were, and you wanted to be one of those people. Like somehow in future,
Yes.
you wanted to join that profession like that.
Yes. I will definitely work on it. This I haven't written anything. It's just like this is what I've wrote in my personal statement, so I just like
It's really
regurgitated
good.
it back.
Yeah, I don't know my answer yet, but your answer was really good.
Thank you. Thank you.
Yeah. So anybody else wants to speak on this question? Because that's a very likely question. You're going that's going to be next question, right? Apart from why I am or this, why you wanted to be a doctor. Anybody else? Even it's fine if you haven't drafted, but you have anything in your mind, you can just right now speak.
So I think that you can mention why you want to be a doctor during the tell me about yourself, what brought you into medicine. So most people actually say that. So this question is not usually asked because either you're the first generation, so you're inspired to be a doctor to help your family in a certain way. Either your families, you have physicians, so you usually get the part. Tell me why you want to be a doctor. You usually say it when you're talking about yourself. I think so. What do you think?
Yeah. So should I answer the question like what I have in my mind?
Yeah, go ahead.
Yeah. So yeah, that's a very good question. So going down my memory lane, I remember as far as I was 6 to 7 years old, my inspiration to become a doctor was from my uncle and aunt who ran a maternity hospital. I was really fascinated by the way the stethoscope, the white apron, and when how they used to deliver the babies, sitting in their OPDs and looking after the patients and doing the hospital rounds. So the my favorite hobby as a child was playing doctor. I used to wear my mom's blazer, and I used to do a cesarean section as I used to see on television on the on the soft toys. Then I used to run my own clinic, giving imaginary medicines on a piece of paper. Checking my toys, listening to their heartbeat and everything. So yeah, I was very much fascinated. And as I grew up, my fascination grew, and I worked hard during my 11th and 12th standard and secured a seat in my medical in a prestigious hospital of North India. I ranked 22nd amongst 22,000 applicants, and today I'm sitting here in front of you applying for my internal medicine residency. So yeah, that's my inspiration for becoming a doctor.
Very well done.
Can I give feedback?
Go ahead, please.
Yeah, first of all, it was a really good answer. Like I really liked like how you you played doctor and stuff. I have this problem, so I'm just saying it. Uh, it feels like there is someone that like is orchestrating the answer when when you get nervous, your head moves in an extremely rhythmic way. So it feels like the interviewer will also just he'll just bob your head with your way. I mean, it's not a comment or anything. I think it just someone told me that it shows nervousness and anxiety. So I think someone told me that you can like press a ball, like these are squishy yellow smiley balls, right? Oh, you have it, of course. So yeah, maybe you can do that. Otherwise, great answer. I'm just saying this because I don't want the PD or someone to think that this guy just rehearsed like an actor, because you're genuinely interested in this, and I can see the genuineness in it.
So that's a perfect feedback. Yeah, that's what even I feel because I see a video of mine, the recorded session. I do a lot of head movements, and I was saying the same to Unaib also. Like he and I and him do a lot of hand movements as well. So we should work on that because yeah, it looks like I'm nervous while answering. So I'll work on that. Thank you so much. Yeah. So like, should we move on to the next person? Anybody else wants to speak on why I want to be a doctor?
If I may, I don't actually have an answer, but like I was trying to frame one and I had some issue with the content. Can someone help me out? So basically, like one of the reasons why I wanted to become a doctor was that well, I mean, like I had like parents who are doctors, so like that is there. But like more importantly, like what strengthened my resolve was when I was in my 12th, like my final year, 1 month before my exam, I had a bike accident, and I ended up like having some back issues, and I was in bed rest for like months in this thing. So my question was like I wanted to talk about this because like like experiencing the improvement firsthand. I suffered like when I had the accident, and then over months, like over the period of months, through treatment and whatnot, I could like firsthand like experience the improvement and see the drastic change that like medicine can bring about. My issue was that like should I mention this because like the thing is like it's always kind of tricky mentioning that if you have any like significant medical problems, like would they consider like would it stick in the back of their mind that like can this guy work like because it's something like I have no issues now. Like this was like many years ago, and I'm like able to do it now, but I still don't want that thought. I don't want to leave that thought in the PD's head. So what do you guys think about that?
So, Doctor, like,
So instead of
go ahead, Archie. Go ahead.
yeah, sorry. So instead of talking about a major bike accident, you could just say you fractured your hand or something. Don't like make it like sound like, oh, I couldn't walk or do something for many months. So I mean, I know it's not okay to lie, but instead of making the PD uncomfortable, thinking, oh, maybe what if like you have some long term like disability, or give them a you know that kind of, don't like give them that position to doubt your capabilities. So you just say like hand fracture, like I mean something like that. I don't know if
Yeah,
you
you
say
could do that, but I think that even if you had a back injury, you had that in your 12th grade. You did your med school, you went to your house job, maybe you went to United States. If you went to, you did everything like that. I really don't think the PD would be in that he might not be able to work, but obviously it's your call that you could downplay and make it a hand injury, but whatever. I don't think that would be an issue because you've been through your life, you did all your med school, your house job, and it's very tough. House job is not easy to do that.
Yeah, absolutely. The thing is, I had the same issue like when I was like writing up my ERAS application, they asked for that impactful experience, right? Because like I actually did want to like mention this as well because like it was a long this thing, and like I my my 12th grade like the scores tanked because like I had the accident 1 month before the exam, and then I had to spend like the next year studying for like NEET while in bed rest. So like I kind of wanted to mention it, but again, the same issue I had in my mind. But your point, I do get that the fact that like like it is at the end of the day, it is my call. But I do get your point that like they would see that I came through med school through like internship and whatever, and like they would understand that like okay, it's not going to if it hasn't affected him till now, it's unlikely to affect him further.
Yeah, and even
Correct.
Doctor,
Need to
I
do
want
it,
to add something.
but
Oh,
I'll
sorry. Yeah,
I
please go
wanted
ahead.
to say,
So I know one resident who's
yeah.
campus. Right? It is difficult for him to interact with the patient, but he is a resident right now. So, like that hampers his. That's a kind of disability that affects your daily life. But yeah, as Dr. Nate said, you do it regularly. You have done your medical school, you do your hobbies, you have done your house job and everything, and it doesn't affect you. So yeah, you can just talk about that because it is not a disability. It didn't lead to a disability, right? You can function as a normal person, right? So it's up to you how you want to take your call, like what you have mentioned in your impactful experience, because yeah, you cannot just have a discrepancy in what you mentioned and what you're talking about, right? So that's your call, but yeah, I don't think it will actually matter that. So yeah, so should we move on to the next person, or somebody else wants to add?
I just wanted to tell him one thing, that you had a problem and then you recovered it. This is already your strength point. So you should mention it, but don't just keep mentioning that how you were bedridden and how you couldn't walk. You just mention it in one sentence, that I had a major injury and I was bedridden for some time, but there was this doctor, he was really empathetic. He would sit with me and he told me that you should recover like that, and he helped me so much that I changed my decision. I wanted to be a doctor. When I was able to walk the next month, I knew in my head that I was very clear about it, that all my life I saw my parents, they were doctors, but just in that moment, how that doctor helped me, and how he was like empathetic, and how he was really kind to you. So mention those points more than your problem. Just mention your problem in one line and then move to the strengths you gained through it. So that's how you should do it, I think.
Thank you so much, Hina. That's actually like extremely good advice. I think that's probably what I'll end up doing. Just like mention it one line
Yeah.
and then talk about more
Mhm.
like how it like strengthen the desire to like do medicine. I think that's a better way to
Yes.
go about it. Thank you so much.
Yeah, you're welcome.
Move on to the next person. Like yeah, if anybody else wants to speak on why you want to be a doctor. Hena, you want to talk about that?
Actually, I don't know my answers yet. I'm just listening to people and their experiences, and I'm just creating my story. So what this guy told, now I have kind of same thing, that I wanted to mention some disease in past, but more importantly, he was in 12th grade, but I was like 10-year-old, and then I would mention that it is a timeline when you reform your personality and when you think about your life choices. So at that time, when you are seeing something or you are suffering from something, at that time you reshape your life decisions. So that's how I think I will shape my answer, but I don't know exactly, so I'll take a day or two and then I can join that.
Okay. So anybody else wants to talk about it? Harshita, like, do you want to talk about the answer you have?
Oh, I haven't thought about.
Anybody else have, like, why you wanted to be a doctor?
I have one answer that
Yeah,
I
go
would
ahead,
like to
Dr.
share.
Rajani. Yeah, go ahead, please.
So going back to my memory lane, when I was in my 11th or 10th grade, I was involved in a volunteering centers. It's called the Objetic Foundation. I was in their teaching department. I tried to taught slum uh, children who were deprived of the education. So they had problem or issue to get enough food, money, and everything. And they were also suffering from different kind of disease like malnutrition, respiratory tract infection, asthma, pneumonia, different issues. On the time, I found there were several community clinic doctors. They came and they provided good care to the children, and that made a great impact on their life. And growing up in a developing country, I found due to the healthcare disparity, lack of resources, most of these peoples they would not get the enough treatments what they should. And I believed on that time, seeing those community clinic doctors, that if I become a doctor like them, I could make a great impact on the patient's life. That motivated me to pursue my career in medicine field, as well as my dad motivated me that we don't have any doctor in our family. You should make your career in medicine. So both of that factors so that motivated me to become a doctor. Still now my dad call me and say how far you are from the residency training and when will be a resident. So yes, these are the motivating factors that motivated me to become a doctor.
That's a very good answer, Dr. Rajani. Yeah, that's a good
I mean,
answer.
no one, yeah, no one in my family is a doctor, mom and dad.
That can be an inspiration. Definitely, you don't have a family, and then you had certain experiences that pushed you becoming a doctor, right? Because what I mentioned was because I mentioned that in my CV and in my personal statement, so I talked about it. But it's a very good point.
So, do you think I should make a story like one day a person came and her both of son were malnourished and they were treated by the doctors and made a good impact. Do you need I should add some story on that or
No,
whatever I said was
whatever you
enough?
ask, just make sure you don't have to, answer this question only during the interview. You have to try to cover maximum number of questions. So yeah, just make just whatever you want to add, just draft in a way that it ends in 60 minutes, not more than that.
Okay, thank you.
Right? Otherwise, it's a good points you have. Yeah. So, Indu, you want to talk about the question like why you want to be a doctor?
Okay, me, I was not ready, but yeah. Okay. That's my the genuine answer. Like when I was a kid or when I was growing up, there used to be a small clinic of Dr. Shah, Dr. Sa. I was in Gujarat, Ahmedabad. So we used to visit to him. And that was like quite a young age, like 10, 12. But later in high school, when I reached high school, like, 10th, 11th, then I realized how a doctor makes a big difference in society, right? In a real sense. They bring smiles to the faces of patients when they leave their clinics. And also, a doctor gives a part of him or her to the patient in terms of time, empathy, help, and emotional touch, which is much, much more than money can buy. That further strengthened my desire to, pursue medicine. That's how I'm here. Thank you.
That's a very small and concise answer. That's a very good answer. Yeah, small
Yeah,
and
I
concise.
like that.
My only note is
Fine.
that, like, whatever you change, please talk about it in the exact same tone, because the way you talked about it, it showed passion. It showed, like, like you really believed
Mhm.
what you said. It felt very genuine, the answer. So whatever adjustments you make, that's at the end of the day, that's your call. But I would love it if you said the answer the exact same way how you talked about it now.
Are you talking to me, Om?
Yes, yeah. Yeah.
So what did you like, or what's your? I didn't get it.
Sorry. What I was saying is, like, the way you talked, like your tone, your voice, and like how, like,
Yeah.
you felt like I could feel, like, you were passionate and like this thing. So that was my note. Like, I wanted you to
Yeah,
maintain that
that's what.
in the actual
Yeah,
interview.
that's what really happened. Like I'm saying
Okay.
from my memories. Yeah, that's
Mm-hmm.
why
That's
I
good.
could bring that feeling.
Yeah, that's really good. Like,
Like,
that was my point, to like say it exactly this like the same way as you like talked here, like, say it in your interview.
awesome. So you liked it, and that really
Yeah, I
happened.
really
Doctor
liked it.
Shaw was my neighbor clinic, and this is how things happened. Okay.
That's very
I
good
really
that
liked it.
you
It's a really
remember
good
the name.
answer.
Yeah. And that's good that you even remember the name. That shows that you had actual inspiration from him, right? So it's
Yeah, thank you.
yeah. So yeah, anybody else wants to speak about this question? Like why you want to be a doctor?
Hi, everyone. This is Ranjini. If there's time, maybe I can give a try.
Sure, go ahead and please be a little bit more loud, Dr. Rajini.
Sure. Can you hear me now?
You, but yeah, you should be like a little bit more loud so we can hear you better.
Okay. Okay. So I haven't prepared anything actually, but I want to try. So why I wanted to be a doctor was actually based on an inclination I had when I was growing up. It wasn't strong though, to be honest. It was based because I lost my father very young when I was very young to a glioblastoma, and it kind of made a deep sense of loss in me. So I kind of thought that maybe there was something that could be done as a doctor. If he had diagnosed earlier, maybe the outcome might have differed. So that was one inclination I had. Secondly, it was my father's attitude towards life, because I have seen him coming from a very poor background, moving to a foreign country, trying to relearn his educations. Even though he was not from a medical profession, I have seen him help others in the best way he can, and not only manage to change his life but also impact others' life. So I thought, what would be the best way to impact other people's life than being a doctor. So that was initially the inclinations of pursuing a medical career, but it was only until my internship where I really developed passion for the field, where I got to work in a district hospital with limited resources and very poor people. I got to be interacting with them, help them identify their problems and help them in any possible way I can. And that kind of brought changes in their life as well. So I would like to say that I didn't choose medicine, but eventually medicine chose me. So that's how I think that's my story of becoming a doctor. Yeah. Thank you.
Dr. Rajani, 110 from my side. Like it's a perfect answer, very well articulated. You speak very, very well, right? I just need to learn some things from you. And yeah, you can just use like a word like underprivileged. That would be like sound more good. Otherwise, it's a very, very good answer.
Okay. Okay. Thank you.
Uh, I also really like your this thing. I just had a couple of clarifications. I just want to ask, when you at the start of your this thing, you said like your first inclination wasn't major, like as in like like it wasn't like a strong this thing, like it. So what were you talking about at that point? Like what was the strong inclination? I was just a little confused.
I think it was wrong choice of word, to be honest.
Uh-huh.
It was
Mm-hmm.
actually what I tried to convey was that my passion for medicine didn't come at first. It actually grew on me rather than
Okay.
I had a passion and then went into a medical profession.
Mm-hmm.
I just wanted to convey that it kind of like a plant, you grow that
Mm-hmm.
passion. So that was what I was trying
Okay.
to convey.
I
Um,
see.
so yeah. maybe I
Uh,
think what you said was right. I kind of
mhm.
chose a wrong word
No,
to convey the message.
the thing what I had was you said that line, and then
Okay.
immediately you went into the story of like how your father like had unfortunately passed away. So like
Yeah.
putting those two lines like next to each other, like immediately like I think you should just like rephrase that or like eliminate that first line entirely, because
Sure.
saying like my first inclination wasn't major, and then
Okay.
saying the story about your father in the immediate
Okay.
next line, it doesn't like sound very like, I don't think
Okay.
it gets your point across like clearly.
I agree. I agree. Yeah. So
So yeah.
would it be good if I just say inclination and not major inclination like that? Like I had an inclination towards going into medical profession because of my father, and then go with the story of my father.
I think it would be like if I had to rephrase it, I would say something like the start inspired you, but then
Okay.
the desire to practice medicine grew. Like you can say something like that. So you
Okay.
can,
Okay.
it's
Yeah.
a small inspiration at the start, but then
Okay.
that inspiration, that desire to do medicine grew over your experiences like later on. I think
Okay. Yeah.
that's something I would phrase it. I would polish it a bit more. But yeah,
Yeah.
that's
Thank you.
how I would go about it.
Yeah.
You can try something like
That's
that.
a good point. Yeah. Thank you. Thank you so
Mhm.
much.
No problem. You're most welcome.
So anybody else wants to just move on and talk about, because I think we just covered two questions. One is the why, tell me about yourself, and the other one is why you wanted to be a doctor. So anybody else wants to talk about this question?
I have a suggestion for Dr. Ranjani. So there's a part in her answer, like her answer was really good, but there's a thing, I think, line where she said medicine, sorry, I didn't choose medicine, but medicine chose me. So I think you can just, I don't know if you can just stick with like medicine chose me or something. Like, because if you just say I didn't choose medicine, like,
Okay. Yeah.
it
I
would
get your
have
point.
a,
Yeah.
like a negative impact. Like, I'm not sure if anyone wants to like.
I just feel it's a catchy line, like that. That's some makes her answer very unique, right? Because most of us have a similar kind of wording and everything, but I just feel it sounds really good, right? It's fine
Yes,
that.
also. Mhm.
And one more thing,
Yeah,
I
you
feel
can.
that you don't need to have an inspiration from birth, right? Everybody like me is not going to have inspiration from 7 to 8 years old. Some people can have it maybe by 11th or 12th standard. They can aspire to become a doctor. Some people might be doing the middle school, or somebody might, not never wanted to be a doctor, but after coming into this profession because they're forced by their parents or by peer pressure, they became a doctor, and after that they started loving this thing, right? So I think the answer is very unique, and for me, that is a catchy line. Like medicine, I didn't choose medicine; medicine chose me. Yeah. That's my opinion. Yeah.
Okay. Anybody else has any opinion about that? About
Dr.
that
Pajini,
line?
you are saying something.
Aishma, I want to you are perfectly okay. Just one word modification. So I didn't choose medicine, but medicine chose me. That's perfect. But in this, only one thing. I didn't choose. Instead of that, we can say my interest grew over the time, and I feel medicine chose me. I didn't choose medicine. Like, we can modify that sentence.
Yeah.
You
Okay.
guys can.
Yeah. I get.
Yes, I think, yeah, when you're telling your story, it already shows that medicine chose you. Maybe you don't need that thing, and your story is quite impressive. So I think you can skip that line. That seems like you have prepared it, like you prepared for your interview. That's something, but scripted line, something like that, like how you read in books.
Okay.
These,
I get.
yeah. So
Yeah.
maybe you can skip that line. Your story says it itself that medicine chose you. So
Okay.
you don't need to tell it like that, maybe.
Okay. Thank you. Thank you guys for the feedback.
So should we move on to the next person? Like we're done with Dr. Rajani. Anybody else wants to speak up? Because tomorrow onwards we might have the new questions we want to discuss, because we don't want to get stuck on a particular question. Because I feel like after 20th, more and more people will start. They won't be interested in these sessions because more and more people will start getting the interviews, and we will be busy preparing for that. Right? Like we're done. We should just try to cover as much questions as possible. Yeah, Dr. Jatin, please go ahead.
Hello everyone. So I would like to go with the answer why I wanted to be a doctor. So as you, so most of the people have a reason, like some of their parents are doctors, some are educated. So I belong to a small town, a village in Punjab, India, where I cherished my childhood memories. And at the age of 12, my parents planned to send me to a boarding school and to have some better opportunities uh, in my future. And then I used to come back home for summer vacations and all. And at the age of 14, when I was home for summer vacation, I realized that my father was not well. And I got to know when I came home, and it was that he was diagnosed with hepatitis C. And at that time in 2008, we did not have a proper cure for hepatitis C. At that time, only ribavirin and interferon gamma, they were the only therapy that was possible at that time. And the treatment, it was very harsh and it was very difficult for the patient. I've seen my father struggling with the treatment, and as soon I had to go back to school, and there was only the letters, they were the only source of communication I could get back to, because the calls were not allowed. So it was very difficult for me realizing their situation at home. And then I used to figure out ways how could I help them find ways in their libraries, my school libraries. And after a certain period of time, with the treatment, the same treatment, we had won over the treatment. Like we had won over the disease, and he's completely fine now. And at that time, I realized how powerful medication can be and timely diagnosis can be. Thereafter, I realized I put my volunteer works into my school, nursing homes, and all, and that actually paved my path to be a doctor. Thank you. Any feedback?
So I think Dr. Jatin, it's a very good answer, but the only thing you need to work on is the length, right? You just need to, choose your words wisely. Otherwise, it's a very good answer.
Thank you.
Yeah, I think you're speaking for the first time. Just draft your answer well. Otherwise, it's a very good reason that why you wanted to be a doctor, because you have a personal life event, and that too with a very close person, your father, right? So it's a very, very good answer. Just draft it well and make it a little bit smaller so that you don't take that much time speaking.
Yeah, I mean, like, I guess exactly the same this thing as like what Ayushman said. Is just that it's a little like lengthy. What I would do, simple thing, like just type out whatever you said just now, throw it into Chat GPT, ask it to make it shorter. Like
Right.
you can say the same thing and get the same point across in fewer words. It'll cut down time. And with you, honestly, I would recommend you practice like speaking this line out, because I don't know how well you've prepared, but like a lot of like the time in between went off and this thing. Maybe you're saying it for the first time. I completely understand. But like if
Yeah.
you can eliminate that, it would shorten it like considerably. And like it's a very good it's a very good like answer. If you shorten it, it'll like retain the interviewer's interest, like and like it'll end up being a very good answer.
Thank you.
Yeah.
Also, Dr. Jatin, the first sentence you said, a lot of people have physicians as parents. I would just cut it out because I wouldn't start with a negative sentence like that. So just go to where you were born and your situation.
Yeah, just your story. No need to add like some people have this family or some have other reasons. Just go to your point why you want to be a physician, why you wanted to be a doctor, what's your inspiration. Yeah.
Yeah, I'll work on that. Thank you.
So yeah, very good answer. So like, should we move on to the next person? Yeah, before that, we should just discuss what questions we want for tomorrow. So one is the US healthcare system. We couldn't cover it today, right? Why you wanted to be a part of the US healthcare system? Anybody else has other suggestions? Dr. Onaib or anybody else?
Strengths and weaknesses.
Strengths and weaknesses. Okay, like we can just take with the one like strengths, right? And tomorrow, or
Yeah,
both,
we can do that.
or yeah, strengths and the weaknesses, and the other one is the why US healthcare system, and we won't be taking too much of feedback from tomorrow. We'll just type that in chat box, right? So that maximum number of people can get a chance, because today Saurav and Jatin couldn't get a chance to speak for the first question, right? So tomorrow we'll just speak, and then we can just type the feedback in the chat box, so that maximum people can who wants to speak, they can speak on the they can just answer the question, right? So like, anybody else wants to talk about why you wanted to be a doctor, or we should just end?
I just have one question, not regarding I want to be a doctor. It's a general interview question. Like, if someone has more experience on how to, curtail, because as we are not native English speakers, we do say and a lot. So, is there any particular way that you can out practice that? If any, if some people can pitch in on that.
A simple way to do that, I mean, like a simple way to do that would be just to time yourself. Start a stopwatch, and then, like, start it, say your answer, and then stop it. See how much the time is how much time it takes, and then, like, just keep practicing. Like, try to get the time shorter. Eventually, like, when you're trying to do that, you'll and as you practice, those ums and uhs will, like, kind of go, because, like, if you practice your answers, it kind of, like, you just have it ready, right? It is kind of a balance where, like, it shouldn't sound like you're reading off of a script. It shouldn't sound like robotic. It should still sound like you talking. But at the same time, those, like, long pauses where you're thinking of the next line shouldn't happen. I think that just comes with practice. I would recommend just, like, keep a stopwatch or a stop clock in front of you and time yourself.
And practice maybe in front of mirror, or just record your audio and listen to it. Like, you can just come up with the where are the weak points, and you can improve on that. Yeah.
Thank you so much.
Okay. Right. So should we end the meeting, or anybody wants to talk about any, like, even tell me about yourself? Like, Saurav, do you want to go with that question, or we should end? Do we have Saurav or Jatin with us? Yeah. If anybody wants to talk about that, or why you want to be doctor, otherwise we end the meeting, and tomorrow we'll come up with 3 questions. Why US healthcare system? What are my strengths and what are my weaknesses? Right. And guys, make sure that after 20th, most of you will be getting the interviews, right? That IMGs say start getting interviews, so we won't be having time to discuss and practice, right? So just frame your answers. I just have framed only one question so far, that is, tell me about yourself, and I have to work on that as well, right? I know it's difficult, but yeah, we just have to frame our answers so that we don't keep it for the end. So yeah, should we end the meeting? I think everybody's leaving as well. Anyways, see you tomorrow, and thank you so much for joining. We had a great session.
Bye.
Bye.
Thank you.
Thank you, guys.
Thank you.
Yeah, I'll just post the questions in the group, and then you can just draft it and come up with the answers tomorrow. Thank you. Have a good day or night ahead.
Recording stopped.